I'm here with epidemiologist Bonny Specker from South Dakota State University, who is going to give us an update on everything that has been happening COVID over the last week, and also give us an update on bed availability in South Dakota. Bonny, what do you have for us today?
Well, I've heard a lot about bed availability recently, and I just wanted to go over some of that data that's available on the dashboard, and also why it's so confusing. And I also am confused, so I don't think I'm the only one out there. But this is an example of the ICU bed availability that you see on the Department of Health dashboard. And if you notice down at the bottom, they have on the dashboard that in order to calculate the percent of hospital beds, intensive care unit beds, and ventilators that are available, the Department of Health combines information from the Have Bed data system. This is actually a federal data system that hospitals input data on what their surge capacity is during an emergency or a disaster, which we are in right now with the pandemic. And then they combine that with the South Dakota electronic disease surveillance system that tracks how many of those beds are actually occupied. So that Have Bed gives you how many beds are there, and then the disease surveillance system lets you know how many of them are actually occupied. And this is from today, where they say that 12% of the ICU beds are COVID occupied. Now, I have been keeping track of this up until about the September 11th was the last one I entered. And I stopped including this or updating this information because it just became clear to me that I didn't understand what these data were saying or where it was coming from. And part of that has to do with that Have Bed data system, and I'll try to explain that a little bit further. Originally, I thought that they were always using this denominator, 350 beds. That was in a news release that came out of the state back in May. And I just wasn't sure what was going on and looked into this Have Bed a little bit closer. And here's part of the reason why I wasn't sure about it. If you looked at the data from July 1st, there were 68 patients that were actually hospitalized with COVID. And that dashboard said 6% of the ICU beds were occupied. Then you look all the way to September 23rd as an example, 192 hospitalized patients, 6% of the beds were occupied. So something in the denominator has to be changing. And there's a couple ways that you can see this. One is that the percentages of these patients that are actually hospitalized that are in the ICU may be different at these 3 points. And I was only tracking ICU beds, nothing else. They also have hospital beds and ventilators that they put on the dashboard. But then I thought, well, is there something else that's going on that's influencing these numbers? So in looking into it a little bit further, that Have Bed counts surge beds, surge capacity. And a surge bed is defined as additional inpatient beds that are not necessarily operational or staffed. An example of this is Brookings, which is licensed for 49 beds, but has the capability for up to 80 patient beds during a surge plan, in their surge plan. When are the beds counted? When is that data updated? Well, it can be reported more than once in any one day. So it can be varying from day to day what the denominator actually is. If a hospital decides that they can't use some of those surge beds, maybe it's a staffing issue, then they can get onto that data system and lower their number of surge beds, or maybe they've identified a place where they can put more beds, then they can up it. So it varies from, day to day. It could be varying. So it's really difficult to interpret that percentage. Here's an example. Brookings, this is the Brookings Health System surge capacity. It's their surge plan. So they have up to 80 beds, and they list here where those beds are. As I mentioned, they're licensed for 48, and they can handle 45 patients. So if they're asked, well, what is your surge capability today? Maybe they don't feel they can get the staff, it would be lower than that 80. If they can get the staff, it would be that they could take it up to the 80. So they enter that data into the system when there is a change in what they feel their surge capacity is. And we do, by the way, put that in the city threshold report on a weekly basis that the city posts. We have the surge capacity, or whether or not the health system feels that they can handle a possible increase in the number of cases. One thing that's also really important to consider, and I've mentioned this a couple times already, is that staffing in the surge plan is extremely important. COVID patients in the ICU do require specialized care 24 hours a day, and they will need to have pulmonologists and other critical care physicians. I did a quick count of those this morning, and there are 35 in Sioux Falls and Rapid City combined. So those 35 physicians need to handle all of the patients, at least in Sioux Falls and Rapid. There are also critical care physicians in Aberdeen, Mitchell, and Yankton, I think. But there's also a need for specialized nurses and also respiratory therapists if a patient's ventilated. And then you have to remember that there's non-COVID related illnesses as well that need to be managed. So staffing issues are going to become increasingly important. We've seen a lot of hospitalizations this past week, and as those hospitalizations increase and healthcare workers become ill, that's going to be a real strain on healthcare staffing. So we really need to do whatever we can to keep our healthcare workers safe. So please follow public health recommendations, socially distance, wear a mask to protect others when out in public, and practice good hygiene because lives may depend on it.
So Bonnie, what updates do you have for us this week on what's happening with COVID-19 in our city, in our states, and across the nation and world?
Well, I have quite a few. It was not a good week for South Dakota. Brookings County is doing a little bit better. It's still considered to have substantial community spread. There were 88 new cases reported this week for a total of 768. As of today, there are 116 active cases, and the number of active cases actually looks like it may be starting to go down. There have been 3 new hospitalizations this past week with no additional deaths. So there's a total of 13 hospitalizations and 2 deaths for Brookings. The percent test positivity over the past week continues to be high. It did decrease today, down to 17% for the 7-day running average, but that's still pretty high. The World Health Organization recommends that it's below 5%. We did get an update on the age distribution of cases in Brookings, and we'll talk a little bit more about that in depth next week. But in the 10 to 19-year-old age group, that was the largest number of new cases. There were 36 new cases between the 15th and 24th of September. And in the 60 to 69-year age group, that was the largest percentage increase. So there were 7 new cases there. The 20 to 29-year age group, there were 22 new cases. That was the smallest percent increase. They now have a total of 387 cases in that age group. So it was just a 6% increase. So we do get that data from the Department of Health. It's not something that's on the dashboard, but we specifically request it, and they're nice enough to provide it. As far as South Dakota, the new cases increased from 2,068 last week to 2,869 this week. Given the large number of new COVID cases in the 60+ age group this past week, there were 668 of those. That age group has a 21% hospitalization rate. So I estimated that about 140 new hospitalizations are expected in just this age group alone over the next couple of weeks. And the total number of positive cases among institutes of higher ed, students and staff, are 1,263 among the students. This is cumulative, not in the past week, but overall. 66 among the staff. For K-12 students and staff, those numbers are 968 and 406 respectively. So a lot more K-12 staff are getting ill than the higher ed. I think it must be because they're up closer to the students than in higher ed. The percent positivity for the past week continues to be high for South Dakota at 29%. New hospital admissions continue to increase with 191 hospitalizations this week compared to 126 last week. The 7-day running average of new hospitalizations per day has actually broken previous high records every day for the last 11 days. And as of today, there are 209 individuals hospitalized with COVID compared to 161 individuals last Monday. There were 16 deaths this week compared to 18 last week for a total of 218 deaths. The percent ever testing positive, and this is where I look at different things by age. That 20 to 29 year age group has the highest percent statewide, 4.4%. And it's estimated that 80% of the population would have to be immune to COVID before you get herd immunity, which means that in order to get there, you would have an awful lot of illness and death if that immunity is reached without a vaccine. The percentage that are hospitalized for COVID of those that test positive ranges from 1% in the less than 20 year age group to 33% in that 80 years or older age group. And the percentage of COVID cases that die among those that have tested positive ranges from less than 1% in the 20 to 29 year age group to 19% in that 80 years or older. And there have been no deaths among individuals under 20 years of age. Nationally, 7.3 million total cases. So the number of cases per day has gone up from 42,000 per day to 45,000 per day this week. 209,000 total deaths, with average deaths per day decreasing slightly from 800 deaths per day a week ago to 760 deaths per day this week. Worldwide, we did hit a milestone this week with over 1 million deaths worldwide from COVID. The average deaths have stayed pretty steady. There's 33.3 million total cases, with the number of cases per day at about 293,000. It's going to 296,000 this week. So that's been pretty steady as well. So the world is steady, but nationally it's not as good as what we see worldwide. And we also have the travel restrictions as far as being from a high-risk area. It's listed here, and the website will give you exactly what the issues are. Like some of them, it's a $5,000 fine. Other ones, it's just a warning or a suggestion. So it's a pretty big range on how they monitor it and what the fines are for not meeting the quarantine, the 2-week quarantine. So wear a mask to protect others, and we'll talk to you next week.
Thank you, Bonnie. For those of you that have a question for Bonnie, if you have an Ask an Epidemiologist question, please contact us using the link on the screen or the email address on the screen, and we will get your questions or topics on this video post. Thank you.